Hello, my dear colleagues. I'm very happy to show you the results of an exciting trial that we've started about 1 year ago. We want to address the difficult question of a patient with very severe type 1 diabetes. And we know that these patients can be treated either by insulin pumps with a predictive low glucose system feature or by a pancreatic islet transplantation. What we want to address in this trial is the place of closed-loop insulin delivery. So this is the conflicts of interest that I want to disclose. And this is the scope of what we want to talk about today. This is a patient with very uncontrolled type 1 diabetes with problematic hypoglycemia. We know that these problematic hypoglycemia problems can be addressed either by therapeutic education, by the use of CGM, by the use of a PLGS pump, or by islet transplantation. All these 4 therapeutic strategies have been validated by phase 3 clinical trials performed during the past 3 years. But what we don't know is the place of closed-loop insulin therapy, which so far has not been studied except in one study. And the question is, can we address the problem of highly unstable type 1 diabetes in patients that are contraindicated for pancreatic islet transplantation with closed-loop insulin therapy? So this trial was a head-to-head comparison of a DBL-HU system, which is our closed-loop insulin solution, and we compared this solution with a state-of-the-art PLGS system, namely the SmartGuard Medtronic insulin pump. We decided to include patients with type 1 diabetes that were already on pump therapy and patients that presented with very severe glucose instability, making them eligible for pancreatic islet transplantation. The criteria were severe hypoglycemic episode during the past year, hypo-unawareness, or very high glucose variability. All these patients had been considered for islet transplantation but were contraindicated or refused the transplantation. The DBL-HU system is composed of an insulin pump, a patch pump from Kaleido, a glucose sensor, the Dexcom G6, and a common module where the patients would enter the meals or the physical activities. The algorithm was based upon the DBL-G1 system, which we had previously validated, and we know that this system can be tuned according to the physiology of the patient. So there are some public settings from the DBL-G1, and there are some hidden settings that can specifically address the physiology of patients with unstable type 1 diabetes. The design of the study was a series of N-of-1 trials, namely patients would go through a succession of periods of 4 weeks each, either in closed loop or in open loop in a randomized fashion. So the total duration of the trial was 16 weeks. Here are the results. We have shown that DBL-HU is very efficient. You can see here the individual results of the 7 patients, and you could see a huge improvement in the time in range, ranging from 11% to up to 50% in difference in absolute values. This slide shows you the aggregated results of the 7 patients. In red, the control treatment with PLGS, and in blue, the experimental system with DBL-HU. When we look at the figures, we can see that the time in optimal range jumped from 43% in the control group to 73%, so a nearly 30% in absolute level of improvement. We have a reduction in the average sensor glucose by 35 milligram per deciliter. We also have a dramatic reduction in the glucose variability indices, and we have an improvement in the glucose management indicator. patients were very satisfied with the system. This is shown by the result of the questionnaire DTSQ, and the patient had a reduction in the perceived frequency of hypoglycemia. We also looked at the usability of the system, and it happened that the patients were very at ease using the DBHU system. It happened that the French regulatory agency was aware of the results of this trial, and it approved the compassionate use of the DBHU system in 4 other patients also facing very unstable type 1 diabetes. Here are the results of one patient. This is the CGM data from open loop period, so very unstable diabetes. And this is what we can immediately observe following the closing of the loop, with nearly 84% of time in good range and a dramatic improvement in the glucose variability. So to conclude, we can say that patients with very severe, highly unstable type 1 diabetes can be efficiently treated with closed-loop insulin delivery, which could replace PLGL system. I would like to thank all the collaborators that were involved in this very exciting trial. Thank you for your attention, and I will be pleased to take any questions.